Polycystic ovary syndrome, or PCOS for short, is a condition that affects hormones. It causes irregular menstrual periods, acne, excess hair growth, and also infertility. People don't really know about this condition, and we are going to discuss it today to get to know what causes it, what it can cause, and then what to do when you have PCOS or polycystic ovary syndrome. You are all welcome back to my channel, Time with Nurse Joycelyn. If it's the first time of watching my videos, kindly subscribe to the channel for me. I talk about everything concerning nursing and also offer health tips. Subscribe to my channel for me, put on your notification bells for new updates, and then you like, share my videos, and keep your comment and feedback in the comment section for me. Stay tuned. Polycystic ovary syndrome is a hormonal imbalance condition that occurs when the ovaries create excess hormones. The ovary is the organ that produces and releases eggs. So when this happens, usually people with PCOS or polycystic ovary syndrome may have unpredictable ovulation, missed periods, or irregular menstrual cycle. Also, people with PCOS or polycystic ovary syndrome may have fluid-filled sacs on their ovaries that is visible when they take ultrasound scan. However, despite the name polycystic, you don't need to have these cysts on your ovaries before you can have the condition. You can still have the condition but not have these fluid-filled sacs or cysts on your ovaries when you take a scan. People with this condition are also at a higher risk for certain medical conditions like diabetes and hypertension. The ovarian cysts are usually not dangerous or painful, and most of the signs and symptoms include skin tags, missed periods or irregular menstrual cycle, acne, obesity. You also have infertility or thinning of the hair or baldness. Can someone be asymptomatic when they have PCOS or polycystic ovary syndrome? Yes. Most of the people who have this are asymptomatic. They may really not have any signs and symptoms until when they are trying hard to get pregnant or when they are gaining excess weight for no reason. Now, at what age can someone have PCOS or polycystic ovary syndrome? Normally, it can happen at any time after puberty, and most people are diagnosed with this condition when they are in their 20s or 30s and they are trying to get pregnant. Also, if you have biological members who have had them, you can also get it. And then if you are obese, you are also at a higher risk of getting polycystic ovary syndrome. The exact cause of PCOS or polycystic ovary syndrome is unknown, but there is an evidence that genetics play a role. High levels of androgens or male hormones prevent the ovaries from releasing eggs, thereby causing irregular menstrual cycles. Treatment options also include medications or lifestyle modification or combination of both. Normally, the healthcare provider will determine your treatment based on the signs and symptoms you present with, the underlying medical conditions you have, and also your medical history. However, if you plan to become pregnant in the future, you can be put on medications to restore ovulation, or there can be a surgery to also help restore ovulation by removing the tissue in the ovaries that causes the production of the male hormones androgens. You can also consider IVF or in vitro fertilization if medications to help restore ovulation doesn't work. It should be noted that there is no permanent treatment that can cure PCOS or polycystic ovary syndrome. However, your treatment can be modified in a way. Your healthcare provider can help you treat your symptoms to an extent that you will be less aware that you even have the condition. So there is no cure for PCOS. Is there any way to prevent PCOS or polycystic ovary syndrome? No, there's no sure way to do that. But you can go to healthcare providers for them to help you manage your symptoms so that you become less aware that you even have the condition. They can also help you with lifestyle modification or lifestyle changes, such as eating healthy foods, nutritious foods, exercising, and also managing a healthy weight. Complications of PCOS or polycystic ovary syndrome includes cardiovascular disease, endometrial cancer, endometrial hyperplasia, high blood pressure, diabetes, sleep disorders like sleep apnea, and also depression. Remember to reach out to a healthcare provider if you have symptoms of PCOS so that you'll be sorted out. If you like this video, give me a thumbs up, share for me, and also let me know your feedback and comment in the comments section. Also, it depends on the patient if the patient plans to get pregnant in the future or not. If you don't plan to get pregnant, you may be put on hormonal birth control, insulin sensitizing medications to block androgens, and then lifestyle changes. That is eating healthy and also maintaining a healthy weight.